Respected Chief Guest, Mount Kumar M. Patel ji, and the respected members of the Central Council of Pharmacy Council, and the other guests on the dais, the guests of the dais, many principals and professors have come from different colleges, and my dear students, good afternoon, everybody. So, yes. I really congratulate my principal and other organizers and also the guests for attending this conference, because without the guests, without the participants, the conference cannot be a successful thing. I really congratulate them for organizing this event. And with all the good wishes and best wishes of all of you here, other principals also, and the students and other people, this college has achieved the top position in India in the NAC score. Yes, though it is the first cycle. Of course, autonomy and all these things happens naturally, but in the NAC score, first cycle itself, it has scored the highest position in the country. So I really, and it's all with good wishes of all of us. Neighboring colleges also, they have extended the good wishes. I thank everybody over here. Because here Mount Kumarji Patel ji is here. As a chairman of the institution, I have some concerns. Many things are happening, as just now Mr. Venkatraman is expressing in the last 2 years. It's good, wonderful. Without the good infrastructure of the office, you can't do anything. You can't create an environment and all that. That's a wonderful thing. Many changes, teacher, faculty, student ratio, all these things, changes were happened. The other 3-4 things from my mind. Number one is all the time we are speaking about this system, but I request the President to make the syllabus more flexible, at least to the autonomous colleges, so that to accommodate the other things very comfortably. And especially the Indian knowledge system, Indian systems of medicine are also working very well. You have totally neglected that system. It was proved, Ayurvedic, Unani and other systems are proved to be good. And we have lot of evidences for that. So we have to accommodate all those things into curriculum, at least on the discretion, discretion of the colleges, you can make it happen. So, it will have a great impact on the society. This is number one. Number two is, whatever we are claiming, the research potential, not the potential, research activity of the pharmacy colleges are at very low level. It is not happening. So, at the level of faculty and also at the level of students. So, it needs to be greatly improved. So, higher education means school doesn't need a research at all. But higher education institution means first it should be recognized as the research, for the research, not for education. Education is the secondary thing. Making them pass the examination is the very third thing. The first thing for any higher education is the research. For any university or for any higher education college, the first thing is, inculcate, need not be big researchers. At least we have to inculcate the spirit of research among the students and faculty. Somewhere you have to make it mandatory, at least 2 papers for faculty kind of thing. Even the students are also capable of writing the papers. We can insist on that and make them reliable. This is so important. Everybody knows now the Hyderabad is the biggest center of pharmacy companies. Biggest center of the entire country. It is one of the biggest centers of pharmacy. Where it has come, everybody forgot. It has come from the research of IDPL. Without IDPL, no pharmacy companies in Hyderabad. Yes, it has come from the IDPL research. So that is the very important component in the colleges. So that is the most, a kind of spirit need to be encouraged, need to be installed in the among the students and faculty, and there must be some incentives. Maybe Pharmacy Council can do that. So the big research when there is going on, it can be. And this research colleges cannot do on its own. Research may be given by the Pharmacy Council also, like ASCT and UGC as funds. Research may be done through DST or maybe through some industry. So this kind of facility council need to be done with another kind of conference with the industry and other people. College alone cannot do it, cannot fund it, cannot equip, get ready with equipments. All these things must be done with the support of Pharmacy Council and with the support of industry and also with the college. The third the level is the college. This is the most essential part to make everybody is talking to make them futuristic pharmacists. How can we make them futuristic pharmacists? When there is a research involved into it, then only we'll make them futuristic pharmacists. If we make them pass the examination or giving a certificate, they cannot they cannot be future pharmacists. Yes. So that is a kind of, in the research also, a kind of tangential thinking must be inculcated. One of my students, I think he is very much there here, he is doing the research on the cancer. He says he is trying to prove that for cancer, it is not the habits of smoking or the food or other things are responsible. For cancer, he is trying to prove it is the thinking process that makes the cancer. He is trying to prove. He has written the papers in the Nature, elsewhere, and all these things. And the Boston University is working with him. And MIT University of America is working with him. Yes. I asked him, how can you do it? He has taken the sample of 400 people without any habits but affected by cancer. He is making with his supercomputer, he is very much here, doing it that. Yes, that is a tangential thing, very different thinking. Yeah, very different thinking. He is very much there, I'll call him. So, this is how, we can, any student can do that, can think. Any faculty member can think very tiny. Every doctor is thinking out of your smoking, out of your food habits, out of stress, out of these things. But he is trying to prove this. Boston University is working with him. He is very much in our university and working. And MIT is working with him. Yes. So this is how research matters. The other thing what I request the chairman Mount Kumar Patel is, so this the whole topic is emerging trends in personalized drug discoveries. How you make it personalized if you do not know or aware of the IT knowledge. Yes. There is nothing in the syllabus, in the curriculum given by the Pharmacy Council, IT knowledge. There are no courses for IT knowledge. How can they make it a personalized drug? It is a data to be collected. It is data to be analyzed. It is data to be, the drug to be administered through that. Suppose if there are 10,000 patients, 10,000 patients' history need to be stored, need to be analyzed, need to be, then only drug can be administered. It all requires IT, digitalized knowledge, IT knowledge. There is nothing in that in our curriculum. So we have to introduce at least 7-8 courses of IT knowledge to that. The future is, pharmacy students, future is once we are, we in the next 4 or 5 years, if we get AI doctors, artificial intelligent doctors, they are very fast. Once if the drug is there in US today, and tomorrow it would be there in India because AI doctors are connected. Now the present doctors are not connected to one another. If a drug is there today, it takes 1 year to come to India and administer. It will take another 6 months and test it for another 1 year. But it won't be there in the next 4 or 5 years. Once AI doctors are in the field already there, so they would be totally. I mean, most of the doctors would be AI doctors, and the AI doctors, the biggest advantage of AI doctors is they are connected. The computers are connected world over, like our internet. Internet. This is what is going to happen to tackle all these issues or to make them future pharmacies, really future ready pharmacies. So we have to, yes, IT skills need to be given to them, need to be introduced in the curriculum. Otherwise, they will be irrelevant, very, very irrelevant. So nobody bothers about the regular practice. All the curriculum was designed 25, 30 years back. It should be revamped. That is what I was sharing with the President also. It needs a big revamping at this phase because we have to revamp like how the communications are revamped with the cell phone, how the transport is revamped, how the whole administration is, Andhra Pradesh is introducing WhatsApp governance. WhatsApp governance. You need not go to office, you need not request anybody, you need not beg anybody, you need not corrupt anybody. You can do everything in WhatsApp. When you don't react to that, when you don't react to the trends, you are nowhere. You will be irrelevant. So you will be, the students would be irrelevant. You don't update yourselves. First, principals and faculty need to update and introduce the same thing or make the students ready for that. Then only they will be good in this country and also any other country. That's it. These are the 3 requests. Again, I am repeating. The first thing is Indian knowledge system is a great knowledge. We can't afford to ignore that. Somewhere we have to give the space for that. That is the first thing. Yes, especially in the health systems, Indian knowledge is great. In other systems also, okay. Architecture, we have seen many temples, how they have done. It's a great knowledge. So in the same way, pharmacy also need to introduce Indian knowledge systems into the curriculum. The second thing, research should be considered as the main thing. I don't know how they make it a policy because the council members are there, 3 members and chairman is very much there. You have to make it a policy. What is it you are expecting, minimum things expected from a college, from a professor? How many papers are expected? What is the kind of H index from a professor you are expecting? This kind of regulations, policy making, one can do that. And third thing is, we have to make the students to be aware of, to be familiar with IT knowledge. Otherwise, they would be totally irrelevant. Once again, I thank the President of Pharmacy Council, Montkumar Patelji, for his great presence, inspiring presence over here, and other guests, Radhakrishna Garu and other members of the council, registrar, everybody over here. I thank you, everybody, once again. Thank you very much.